Hi everyone, welcome to Game Pharmacology. In this session, let us recall the FMG July 2023 pharmacology MCQs that were asked in your examination. Myself, Dr. Padmanabha, TS, your Faculty of Pharmacology at Global Academy of Medical Education. Welcome again. So let's start with the MCQs that were probably asked in your exams. So I would love to make a disclaimer that these are the questions that has been gathered from the various sources. It may not be a exact representation of the questions as well as the options which were asked in your exams. So to make those questions as well as the options in a right manner, you can comment it in the chat box if there are any discrepancy in the questions or the options. So with this, let's start with the MCQs. There are 25 solid MCQs that were asked in your FMG examination. So let's start with the first MCQ, that is, all of the following are the adverse effects that can be seen after 1 year of using lithium. So where do we use lithium? Lithium is used in case of the treatment of bipolar disorders. In case of bipolar disorders. So which are all the side effects which you can encounter with respect to the lithium? So they are asking the clear-cut question, that is exception. So please remember, there can be tremors which can occur with the lithium. There can be risk of hypothyroidism. There can be risk of nephrogenic diabetes insipidus and this tardive dyskinesia. So this tardive dyskinesia is the right answer here, because this will be the side effects which are seen with the antipsychotic drugs. Sorry. These are seen with the antipsychotic drugs. Basically, this will going to block the D2 receptors. So tardive dyskinesia is mainly due to the blockade of the D2 receptor, which is caused by antipsychotic agents. So all this will be the tremors, hypothyroidism will be the adverse effects which are mediated by lithium. So how to treat the tremors? Do you know any answer? How to treat tremors? So tremors can be treated by using beta blocker, that is propranolol. So moving on to the next question. Question number 2. A person was brought 2 bottles of alcohol from the alcohol shop. Later he presented with drowsiness, blurred vision, ataxia. What is the antidote for this condition? So what will be the antidote that will be given as a treatment here? So probably this could be a since it's an alcoholic patient, it can be diagnosed as ethanol poisoning, or sometimes it can be a methanol poisoning if it is mixed with the methanol. So what will be the antidote here? Yes, so the antidote here will be here fomepizole. Please remember, the antidote for Antidote for ethanol overdose. Ethanol overdose will be your, the drug of choice will be your fomepizole. So fomepizole is what? How it will going to act? It will going to act by inhibiting the alcohol dehydrogenase enzyme. Alcohol dehydrogenase enzyme. Alcohol dehydrogenase enzyme. Alcohol dehydrogenase enzyme. So what will the correct answer here? The correct option is option B. Option B. So here they can say earlier it was used to be the treatment of or drug of choice for the methanol poisoning. Methanol poisoning. So what about the diazepam? So diazepam is a benzodiazepines, and naloxone will be your opioid receptor antagonist. Opioid receptor antagonist. So what will be the antidote for the benzodiazepines? Benzodiazepine overdose. The antidote will be your flumazanil. Flumazanil will be the antidote for the benzodiazepine overdose. Is that clear? Okay, fine. We'll move on to the next question, that is question number 3. A patient on some psychiatric medication develops a sudden hypertensive episodes after taking a wine. So which of the following drug the person must be taking? So what has happened after taking the wine? So let us recapitulate. After taking the wine, what has occurred is there's an increase in the blood pressure. So which is the drug in the option which is responsible for increasing the blood pressure? So this is the straight away direct question which revolves around the cheese reaction. So please remember, it revolves around the cheese reaction. So what do you understand by cheese reaction? So usually cheese reaction is seen whenever you combine what is called as if a tyramine containing rich food is combined with the monoamino oxidase inhibitors. What will happen? So this will going to cause increase in the tyramine levels. So usually tyramine will be metabolized by the monoamino oxidase. Since you are giving monoamino oxidase inhibitor, what is happening? You are going to increase the tyramine. Tyramine is a indirectly acting symptomatic drug. So these tyramine, what it will cause is, this will going to increase the release of catecholamines. So what will be the catecholamines here? So there will be increased release of the noradrenaline. So this will going to act on the alpha 1 receptors, and this is responsible in the blood vessels, and this is responsible for increase in the blood pressure. Since tyramine has to be degraded by the GI monoamino oxidase, since you are inhibiting monoamino oxidase activity, this will going to increase the blood pressure. So what could be the reaction here? Tyramine is rich in case of wine is rich in case of tyramine. Apart from that, if you consume other products like even the cheese or red wine, etc. Cheese, red wine, or a fish, etc. This will going to increase the tyramine levels when you combine with the monoamino oxidase inhibitors. So here the right answer will be your monoamino oxidase inhibitors with the right answer, right answer. So what is the treatment for cheese reaction? So how to treat it? How to treat it? So you can treat it by with the help of alpha blockers, alpha blockers. So you can go with the phentolamine. Phentolamine will be the drug of choice for cheese reaction, cheese reaction. So next, moving on to the question number 4, that is a 30-year-old female presents with symptom of sadness, loss of interest, decreased sleep, decreased sleep and decreased appetite for 2 months, diagnosis of a major depressive disorder was made by the psychiatrist. So which of the following is the appropriate treatment to be given? So what is the diagnosis here? So diagnosis made is the major depressive disorder. So which will be the drug of choice for major depressive disorder? So it will be your SSRIs, selective serotonin reuptake inhibitor. So here the example will be your fluoxetine, sertraline, etc. So here the right answer is your fluoxetine. Fluoxetine is a drug of choice in case of the major depressive disorder. So next, coming to the question number 5, that is there was a question regarding the penicillin allergy. So any penicillin anaphylactic reaction or hypersensitivity reaction can lead to anaphylaxis. In such case, what you need to do is you need to go for, which is the drug of choice here? Which is the drug of choice? Can you guess it? So A for A, anaphylaxis for A will be the drug of choice. So that is your adrenaline. Adrenaline will be the drug of choice, or it is also called as epinephrine. So what will be the dose? You will give the 0.5 ml, and what will be the dilution? 1:1000. What will be the route? Route will be your intramuscular injection. Apart from that, what are the other drugs you like to give? So you like to give you can remember it as that is A, B, C, D. You like to give adrenaline. Along with adrenaline, you like to give a bronchodilators like salbutamol. C is your chlorpheniramine maleate antihistaminic drug, and also you like to give your very important drug, that is drug of importance. Which will be the drug of importance? That is your corticosteroids. So this will be the life-saving drug. So the drug of choice in case of anaphylactic shock or anaphylactic reaction is your adrenaline. So moving on to the question number 6, that is 45-year-old female was brought to the emergency department by her family members after a intentional consumption of multiple iron supplementation. So this is a case of iron poisoning. So what is the most appropriate treatment for this patient's conditions? So if they're asking about the antidote for iron overdose, so what will be the antidote? So what will be the antidote here? The antidote for iron poisoning will be here. It is divided into based on the route. In the case of acute emergencies, you can go for desferrioxamine, or if you are giving through the oral route, there are two drugs. One is deferriprone and second one is the deferricirox. So if they were asking about the acute condition, so then the drug of choice will be your desferoxamine. So if they have asked about acute condition, in acute conditions it will be the drug of choice. If they have asked about the oral drug, then this would be the option. So desferoxamine for acute iron poisoning, and in case of the iron poisoning antidote which is given orally, your answer will be your desferricirox and deferriprone. So next, coming to the question number 7. So which of the following drug can cause thymine-less death of the cell, or it is also called as thymine deficient cell? Thymine deficient cell death. So which is the drug which is responsible? So please remember, it is your 5-fluorouracil. So this 5-fluorouracil, what it does is it creates the thymidine deficiency by inhibiting which enzyme? Thymidylate synthase enzyme is inhibited. So this enzyme will be inhibited. So 5-fluorouracil will going to inhibit the 5-thymidylate synthase, thereby it causes the deficiency in the cell, deficiency of thymine in the cell, that is leading to the cell death. So here the drug of choice will be your 5-fluorouracil. So next, coming to the question number 8, that is, an HIV positive female is not taking any of the antiretroviral drugs, delivered a baby. So what should be the initial treatment for this newborn? So they are asking for the prophylaxis in newborn. So what will be your prophylaxis in newborn? So it will be your nevirapine that will be given for 6 weeks. Or what is if there is a high risk, you can combine it with the basically the zidovudine for 6 weeks. So if the option was clearly mentioned about the nevirapine, then you should go for the nevirapine 6 weeks. So if the question tells you about the severity, and if there is no option of nevirapine alone, if there is a combination, then you should go with the nevirapine and the zidovudine, that is for 6 weeks. That will be your right answer. So otherwise, always that is the nevirapine 6 weeks will be the best answer. Next, coming on to the question number 9. So what is the drug of choice for cytomegalovirus retinitis, CMV? There was an image which was shown in the exam. So what is the drug of choice for CMV retinitis? So please remember, drug of choice for CMV retinitis will be your ganciclovir. Then in case of resistance cases, you can go with the fomivarsen, etc. Fomivarsen, that is in case of the resistant CMV retinitis, the fomivarsen will be the better drug. So here, since the option is ganciclovir, you can go with the ganciclovir will be your right answer. Next, coming to the question number 10. Question number 10. So this question is regarding the tuberculosis. So they are asking, the tuberculosis patient was put on the bedaquiline treatment. Which of the following is the appropriate mechanism of action of the bedaquiline? So they are asking the bedaquiline mechanism of action. Bedaquiline. So what will be the mechanism of action? Basically, the bedaquiline will going to reduce the energy generation, reduce the ATP synthesis. So your answer should be your ATP synthesis inhibition. So basically they are used where? Used in the treatment of multi-drug resistance tuberculosis, multi-drug resistant tuberculosis, MDR-TB. So this is the one of the newer drug, one is the newer drug. So next, moving on to the question number 11. Question number 11, that is elderly male with urinary hesitancy and retention was presented to hospital. Ultrasound showed a residual urine of volume of more than 140 ml. So which of the following drug is used in the treatment of this patient? So if they give such option, treatment of choice, probably since there is an increased volume in the bladder. So what is happening in the bladder? There is an increased volume. So your immediate action should be, what will be your immediate action? To reduce the pain or hesitancy. So what will you give is, you're going to give some alpha blocker, symptomatic relief. So you need to get a symptomatic relief. To produce symptomatic relief, you're going to give which drug? You're going to give the alpha blockers. So there are two important drugs that can be used as a alpha blockers. One is your prazosin, and alpha 1A selective blockers, that is your tamsulosin. So if the patient, one more important point you should remember here is, if the patient has BPH plus hypertension, then you should go for prazosin. So only BPH, the preferred drug will be your tamsulosin, because of there is no risk of the postural hypotension with respect to the tamsulosin. Is that clear? So if this was a intention in mind of the MCQ setter, then you should go for the alpha blockers. So let us see two more questions related to this. If the question is framed in such a manner, you should opt for the different options. So if the question was regarding the same question, if the last line changes to, the question changes to, which of the following drug is used for immediate relief? So what will be your answer? Immediate relief, it is your alpha blockers. So answer will be your alpha blockers. So if the same question is asked, like which of the following drug is used to reduce the size of the prostate in this patient, then your answer will be your 5-alpha reductase inhibitor. The example is your finasteride will be your examples. So to make it simple, so in case of BPH, you have two modalities of treatment. One is to relieve the pain, one is to decrease the prostate. If you want to relieve the pain, you give a alpha blockers. If you want to reduce the prostate size, you give 5-alpha reductase inhibitors. Again, here you have a alpha blocker, that is prazosin, and particularly alpha 1A, which is present in the prostate, that is tamsulosin. Whereas 5 alpha reductase, you have got the drugs like finasteride as well as dutasteroid. So this will be your right option. So the thing you need to see in your question paper is, make sure that you have, if there is immediate relief, you go for alpha blockers. If they have asked about to reduce the prostate size, you go for 5 alpha reductase inhibitors. Is that clear? Fine. So we'll move on to the next question, that is, so there were few questions. They said the few of the students said that there was a question on pheochromocytoma. So drugs which are given pre-operatively. What are the drugs which are given pre-operatively before the operation? So please remember, what is pheochromocytoma? Pheochromocytoma is basically a adrenal medullary tumor. So what it does, there is a increase in the catecholamine release. Increased catecholamine release. So what will happen if there is an increased catecholamine release? It will going to act on alpha 1 receptors in the blood vessels, and what it does is causes increase in the blood pressure. So it will going to cause increased frequent episodes of hypertension. So to treat it, what you need to do is you need to use two important adrenergic blockers. The usage of adrenergic blockers is very, very important. You cannot use haphazardly, and one has to follow the another. So there is a rationality for using particular adrenergic blocker in the beginning, followed by the another. So what you need to do is, first you need to give, which one has to be given, whether it is alpha blocker or the beta blocker. So please remember, first you need to give a alpha blocker, then followed by second drug will be your beta blocker. So this is the right option. So what happens if you give a beta blocker first? So what will happen in the blood vessel? As you know, there is a beta 2 receptors as well as alpha 1 receptors. Since you are blocking this activity, so this activity will increase, and there is a unopposed vasoconstriction, which will going to increase the risk of blood pressure. So initially you need to block the alpha receptor activity, followed by you need to give the beta blockers. So here the alpha blockers preferred will be your, you can go with the prozosine, or you can go with the phentolamine, or you can go with the phenoxybenzamine. All are the alpha blockers. So is this clear? Okay, fine. We'll move on to the question number 13. A female with postpartum hemorrhage. They are treated with ergometrin already, but it was not able to stop the bleeding. So that means they are telling about the ergometrin resistant PPH. Ergometrin resistant PPH. So what will be the drug of choice in case of ergometrin resistant PPH? So they are also given the clue which of the following prostaglandins analog that can be used in the treatment of this patient. So there is no option of oxytocin. So whenever you treat a postpartum hemorrhage, so your drug of choice will be your, the first drug of choice will be your oxytocin. If oxytocin is not available, then second drug of choice will be your ergometrin. If ergometrin is also not present, you can go with the prostaglandin F2 alpha analog, that is 15 methyl PGF2 alpha analog. The example is your carboprost, which will be given through the parenteral route. So here the best option, the next best option will be your misoprostol. So here the best option will be your carboprost. Is that clear? Okay, fine. We'll move on to the question number 14. So in an endemic area, what will be the dose of vitamin A for a 1 to 3 or 1 to 6 year old child? So here the right option will be your, it is your 2 lakh international unit that has to be given orally for 6 months. So let us see how it is. So whenever you go for a prophylaxis of vitamin A, it has to be given through oral route, and 9 months, till 9 months you need to give 1 ml, that is equivalent to 1 lakh international unit. After that, every 6 months till 5 years you need to give 2 ml for or a 2 lakh international unit. So first of all, so vitamin A is given through which route? It is given through oral route till 9 months. What will be the dose? It will be your 1 ml or it is your 1 lakh international unit. So from 9 months onwards, more than 9 months till 5 years. So what will be the dose? The dose will be your 2 ml or it is your 2 lakh international unit. Since the age is between 1 to 6 years, you can go with 2 lakh international unit orally for 6 months. So this is your every 6 months. So this is the funda to remember. For age more than 9 months till the 5 years, the administration of iron through oral route will be every 6 months. Is that right? Okay, we'll move on to the next question. That is, there was a question regarding a bacterial vaginosis with the questions stating there was a Gardnerella or a clue cells. What will be the drug of choice? So please remember, if you have seen this question, so drug of choice will be your azole, that is metronidazole, sacnidazole, ornidazole, etc. But metronidazole will be the drug of choice for anaerobic infections. So next, moving on to the question number 16. So which of the following deficiency is associated with poor wound healing that leads to diarrhea as well as dermatitis and alopecia? So it's very frequently asked, and you should know that zinc is a very vital component. So deficiency of zinc can lead to all of this condition. Is it clear? Okay, fine. Coming to the question number 17. So which is not used as an emergency contraceptive? So please remember, you can use ulipristol acetate 30 mg as contraceptive agent. You can use the levonorgestrel 1.5 mg, double the dose as a single tablet, and combined oral contraceptive pill 2 tablets repeated after 12 hours it can be used. But here the wrong answer will be here, you cannot use the levonorgestrel 0.75 mg 2 tablets in 24 hours. So right answer will be here, this is the incorrect option. So next, coming to the drug of choice for chemoradiation in cervical cancer. C for C, it is your cisplatin. Cisplatin will be the drug of choice for chemoradiation in cervical cancers. So next, coming to the question number 19. So the question was with respect to the patient had a blood pressure of more than 200 mm of mercury, and there was an intracranial bleed which was shown on the non-contrast CT head. So they are asking which of the drug to be avoided, or drug that is contraindicated. So please remember, which is the drug which is contraindicated? It is your fibrinolytics. lytics will be contraindicated. So basically this is the case of hemorrhagic stroke. Hemorrhagic stroke. Hemorrhagic stroke. In case of hemorrhagic stroke, the drug that has to be contraindicated is your fibrinolytic. So where you can use the fibrinolytic, in which type of stroke? You can prefer it in case of ischemic stroke, but not in case of the hemorrhagic stroke. So next, moving on to the question number 20. So which is the drug of choice in case of facial palsy? So facial palsy, it is also called as Bell's palsy, which is caused by either the varicella zoster or herpes simplex virus or varicella zoster. So basically Bell's palsy is related to the herpes simplex. So initially, since there will be a very pain, instead of giving antiviral drugs, we need to go for a very important drug, not the naproxen, not the ceftriaxone, not the acyclovir. So I need to go with the prednisolone. So initial drug of choice to relieve pain will be your corticosteroid, that is your prednisolone. So after the pain is relieved, you can go with the antiviral drug, that is your acyclovir. For please remember, the immediate drug of choice will be your prednisolone. So this is the direct clear-cut question from the Harrison that I've asked. So regarding the Bell's palsy, what they have noticed is the course of corticosteroid should be given like prednisolone 60 to 80 milligram daily for first 5 days, and later for the next 5 days you can taper the dose. And also the trials have found out that there was no added benefit when you added antiviral drugs like the acyclovir and the valcyclovir. So the first thing you should do is you need to put the patient on the prednisolone. So this will be a very important question, but it is not got any added benefit when it is combined with antiviral drugs. So next, coming to the antidote for benzodiazepine overdose and benzodiazepine poisoning. So what will be the antidote for benzodiazepine overdose? So let us find out. Atropine will be the antidote for OP compound poison. So physostigmine will be your antidote for atropine poison or belladonna poisoning, etc. What about naloxone? Naloxone is a opioid antagonist in case of opioid toxicity. So flumazanil will be the right answer, which is a benzodiazepine receptor antagonist. So again I am repeating, please do not confuse with the fomepizole. What is fomepizole? Basically, fomepizole, it is used as a drug of choice in case of ethanol or the methanol poisoning. And basically it will going to inhibit which enzyme? Fomepizole, it will going to inhibit the alcohol dehydrogenase. Is that clear? Okay, fine. We'll move on to the 22nd question, that is a chronic alcoholic patient presented with the loss of coordination, confusion, unsteady gait. And you have got a vitamin deficiencies. They are asking which vitamin deficiency is more likely to seen with this patient. So since they are saying chronic alcoholic, usually in chronic alcoholic, which is the most common vitamin that will be deficient, it is your vitamin B1. That is your vitamin B1. B1 deficiency will be there. B1 deficiency in alcoholic. So other name for vitamin B1 will be your thiamine. So you need to go with the thymine supplementation. So usually there will be a case regarding long history of alcohol, or they can give a history of peripheral neuritis, and this is the classical sign of Wernicke's encephalopathy. All this loss of coordination, confusion, and the unsteady gait will go with the Wernicke's encephalopathy, and later stage will be Korsakoff psychosis. So in case of the toxication, acute intoxication also, you need to go with the drug like thymine 100 milligram per day. It has to be given parenteral, that is through IV route. So most of the neurological complications is mainly due to the thymine deficiency like peripheral neuritis, Wernicke's encephalopathy, Korsakoff psychosis. So it is also called as anurin. Please remember, it is also called as anurin. So in case of alcohol disorders, please apart from the alcoholic cirrhosis, hepatitis, pancreatitis, peripheral neuropathy, testicular atrophy, very important question that they have asked is which vitamin will going to be deficient. That is your thymine deficiency. So what will be the treatment for alcohol dependence? So you can go with naltrexone, which is a opioid receptor antagonist. It will reduce the craving. Acamprose is a NMDA receptor antagonist. They are contraindicated in renal failure. But naltrexone is contraindicated in liver failure, whereas acamprose is contraindicated in case of renal failure. So disulfiram, it is used as a aversion therapy. So please remember, so disulfiram, where it is used? It is used for aversion therapy. So what do you understand by aversion therapy? Whenever you give a disulfiram, what is disulfiram? Basically, it will going to inhibit the aldehyde dehydrogenase. Aldehyde dehydrogenase. So thereby what will happen? It will going to increase the concentration of the acetaldehyde. So if the patient consumes alcohol, so this concentration will going to increase, and it will going to cause a discomfort or chest pain, vomiting like sensation, difficulty in breathing, tremors, palpitation, tachycardia, etc. That will lead to the uneasiness when they consume alcohol. So only disulfiram has to be given in case of motivated patients. Why we are talking about motivated patients only? Because it can lead to death if the patient consumes the alcohol. If he consumes alcohol, there can be risk of death mainly due to the increased acetaldehyde concentration. So disulfiram, to condition the patient to abstain from the alcohol use. Only it should be used in case of motivated individuals. So as we discussed in Wernicke-Korsakoff syndrome, so main deficiency will vitamin B12 deficiency, and one thing you should remember is you should not give a dextrose before. So you need to give first what is vitamin B1, and second one is followed by dextrose. So it will go with this direction, not with this direction. So this is contraindicated. What will happen if you give a dextrose before? It will going to precipitate the deficiency. So this is the classical triad that can be asked in your exam, that is GOA, that is your global confusion, ophthalmoplegia, and A for ataxia. So drug of choice will be your vitamin B12, that has to be given before dextrose. So let us see why it has to be given before dextrose. In case of Wernicke's encephalopathy, what will happen is already there is a thymine deficiency. So this will going to impair the glucose breakdown as well as going to cause ATP depletion. So if you give glucose, this glucose will going to worsen the impaired glucose breakdown and the ATP depletion. So that is why in case of chronic alcohol overuse or malnutrition, give thymine before dextrose, so that you're going to decrease the risk of precipitation of Wernicke's encephalopathy. Is that clear? Very, very important. This can be your potential MCQ in the upcoming exams. So next question is which is the conservative management in case of appendicitis? Very well explained in the Harrison. I think this is the direct question that I have taken from the arisen. So for the symptomatic management in case of uncomplicated cases, you can go with laparoscopic or open appendicectomy. But if there is a case of what is called as mass representing phlegm or abscess, that will be a difficult condition. In such case, you need to go for a best served treatment with broad spectrum antibiotic. And if there is a abscess more than 3 centimeter, you need to drain it and need to go with parenteral fluid and bowel rest. So this will be your conservative management. And once the patient inflammatory condition has come down, it can be the patient can be taken for appendicectomy. Appendix can be more safely removed after 6 to 4 weeks later. Inflammation has come down. So basically, you need to reduce the inflammation. So here the answer will be your broad spectrum antimicrobial agent for conservative management of appendicitis. So next is Hoffman degradation. So what do you understand by Hoffman's degradation or Hoffman's elimination? Hoffman's elimination. So please remember, Hoffman's elimination is nothing but non-enzymatic degradation. Non-enzymatic degradation in the plasma, or inactivation without the help of enzymes. Inactivation of the drug takes place without the help of the enzymes. So what will be the drug here? The example here, atracurium, cis atracurium, your non-depolarizing skeletal muscle relaxant. So basically, Hoffman's elimination, as we discussed earlier, it is the inactivation of the drug spontaneously without any enzyme activity. So example is your atracurium. So basically, they are the non-depolarizing skeletal muscle relaxant. Their other name is competitive NM nicotinic receptor antagonist. Whenever you are reversing the activity of competitive NM nicotinic receptor antagonist or skeletal muscle relaxant, the drug of choice will be your neostigmine, that is the anticholinesterase. So particularly for the rocuronium and vecuronium, you have got sugammadex as the reversal agent. Since you are giving a what is called the neostigmine, so this neostigmine will going to cause what is called as, they will going to increase the acetylcholine concentration, and it will going to act on both muscarinic and NM receptors. By acting on this, it will going to gain the tone of the muscle, whereas this will going to cause the side effects. So these side effects can be prevented by giving the atropine. So along with neostigmine, you need to give a atropine supplementation to prevent the muscarinic side effects. So is that clear? Okay. Next, coming to the question number 25, that is regarding the three friends planned a trip to Ladakh. During their stay, one of them began to experience the symptoms of headache, nausea, dizziness, and fatigue. So which of the following is the most appropriate treatment? So this is the classic presentation of the mountain sickness. Mountain sickness. So here the drug of choice will be your, so what will be the drug of choice? It is your acetazolamide. Acetazolamide will be the drug of choice. So what is the acetazolamide? So scopolamine, where do we use? Scopolamine basically you are used in case of motion sickness. So basically you use it as a patch. Where will you use? Behind the Mastad process. So sumatriptan is basically used in case of migraine, for acute migraine. In case of migraine, that is acute attack of migraine. Again, promethazine is the first generation antihistaminics. So what will be the acetazolamide then? Acetazolamide is a diuretic agent. Basically, it will going to lose sodium bicarbonate causes metabolic acidosis. So basically the treatment of choice in case of mountain sickness will be your astazolamide for both the prophylactic as well as the symptomatic relief, and this drug has to be taken before travel, before 1 to 2 days before the travel. So the probable mechanism of action is probably it works by altering the carbon dioxide transport in the lung tissue as well as the brain, as well as it decreases the formation of the CSF, as well as it will going to lower its pH also. Okay, basically astazolamide is a carbonic anhydrase inhibitors. It acts on proximal convoluted tubule. It causes sodium bicarbonate diuresis, leading to the metabolic acidosis because of bicarbonate depletion. So apart from mountain sickness, they are also used in glaucoma. So to treat glaucoma, use it topically. The example are dorzolamide and brinzolamide. So side effects with respect to the use of the astazolamide will be your paresthesias, and hepatic encephalopathy. So to treat hepatic encephalopathy, what you give is you give lactulose. Lactulose is a drug of choice in case of hepatic encephalopathy. So these were some of the important 25 MCQ questions that were asked in your FMG exams. Hope you would have answered the right option for all the 25 questions. So just to recapitulate the topics and the important questions finally. So they have asked regarding what they call as lithium adverse effects. So it can cause tremors, diabetes insipidus. Basically it causes nephrogenic diabetes insipidus, and it can also cause what is called as hypothyroidism. So what is the drug of choice for the lithium induced diabetes insipidus? Drug of choice will be your amiloride. So what is amiloride? Amiloride will be your potassium sparing diuretics. Basically it will going to block the renal epithelial sodium channels. So what about the tardive dyskinesia side effect of antipsychotic? Basically it is mainly due to the blockade of D2 receptor. These are nothing but the extrapyramidal symptoms. So which are the drugs which are used for extrapyramidal treatment? So you can go with B. One is piperidine, benzhexol, and benztropine. These are the centrally acting anticholinergic agents. So what is the treatment in case of ethanol poisoning? It is your fomepizole. Basically it will going to inhibit the alcohol dehydrogenase. So next question they have asked was the cheese reaction will occur whenever you combine a red wine, beer, fish or cheese which contains tyramine as a content. Since tyramine requires the monoamino oxidase to get metabolized, since you give monoamino oxidase inhibitor, this will going to increase the risk of tyramine. That will going to increase the risk of blood pressure due to release of catecholamines. So this can be treated by giving the drugs like what is called as phentolamine. So which is the drug of choice for the MDD, major depressive disorder? That is your SSRI, selective serotonin reuptake inhibitors. So what will be the drug of choice for penicillin induced anaphylaxis? The drug of choice will be your what it is called as the adrenaline given 0.5 ml 1:1000 dilution intramuscularly. So which is the drug of choice, initial drug of choice for the facial palsy? It is your prednisolone. Initial 5 days followed by last 5 days you need to taper it. So acyclovir can be tried later. So what is the drug of choice in case of iron poisoning? So please remember there are two drugs, that is the desferoxamine as well as deferriprone and deferricerox. So this is for the parenteral route, IV route, and these two are for oral route. So this is for the acute condition. So which drug will cause thymine-less death of the cells or thymine deficiency cells? So it is mainly due to the 5-fluorouracil which inhibits thymidylate synthase. So what will be the prophylaxis of newborn baby with HIV positive mother? So you need to go with nevirapine. So first will be your nevirapine. So if it is not given, you can combine with the zidovudine for 6 weeks. So which is the drug of choice for CMV retinitis? CMV retinitis, drug of choice will be your ganciclovir. The other new drugs will be your fomiversin and the letermovir. So one thing you should remember about fomiversin is can be used in case of resistant cases. So what will the mechanism of action of bedaquiline, which is a newer antitubercular drugs? The mechanism of action will be your ATP synthesis inhibition. Basically they are used for MDR tuberculosis. So how to treat the benign prostatic hyperplasia in elderly male? So if it is meant to be symptomatic relief, you go with the alpha blockers like prazosin, terazosin. If it was to reduce the prostate size, you go with the finasteride and dutasteride, which are the 5-alpha reductase inhibitor. So tamsulosin is 5-alpha-1A selective blockers. So basically prazosin is used whenever there is an association of blood pressure. Tamsulosin is preferred whenever there is a without hypertension. So next, moving on to the other question that were asked, like they've asked regarding the preoperative management of pheochromocytoma. So alpha blocker has to be given first. Please remember, it is given first, followed by second one is will be your beta blocker. So which are the alpha blocker you can give? You can go with the prazosin, phentolamine as well as phenoxybenzone. Beta blocker this is. So if you give beta blocker first, what will happen? If you give beta blocker, so this will cause increased alpha activity leading to vasoconstriction. So first you need to give the alpha blocker followed by beta blockers. So how to treat postpartum hemorrhage? The drug of choice will be your oxytocin. So please remember, drug of choice will be your oxytocin. If it is not available, you can go with the ergometrin. If there is a ergometrin is not available, you can go with the carboprost, which is a 15-methyl prostaglandin 2-alpha analog. So misoprostol can also be used, but the action will be delayed. So this will have a quick action since it is given through parenteral route. So which will be the drug of choice for bacterial vaginosis? That is your metronidazole. So deficiency of zinc can lead to poor wound healing, diarrhea, dermatitis and alopecia. And drug of choice or chemoradiation of choice in case of cervical malignancy is your cisplatin. So what will be the antidote for benzodiazepine overdose? It is your flumazanil. So which is the drug which is avoided in hemorrhagic stroke? It is your fibrinolytics. Which drug is preferred in ischemic stroke? Again, you can choose fibrinolytic in case of ischemic stroke, but not in case of the hemorrhagic stroke. They are totally fibrinolytics are contraindicated. So warning encephalopathy, again the drug of choice will be your IV thiamine followed by, you can give a dextrose or glucose. So conservative management of appendicitis, it is your broad spectrum antibiotic. Just reason is to reduce the inflammation, to reduce the inflammatory process. So Hoffman's elimination is seen with the atracurium and cis atracurium. So mountain sickness, the drug of choice will be your acetazolamide. So what will be the drug of choice for motion sickness? Motion sickness, the drug of choice will be your scopolamine, or it is also called as, the other name is hyoscine that form a transdermal patches. So in emergency contraceptive which can be used, you can use ulipristal acetate 30 milligram, combined oral contraceptive pills 2 tablets repeated after 12 hours, and levonorgestrel 1.5 milligram single tablet. And the prophylaxis of vitamin A for children's, it is given through oral route, and from till 9 months it is 1 ml or 1 lakh international unit, and after 9 months till 5 years, every 6 months you need to give 2 ml or 2 lakh international unit. So this were the questions which were asked from the FMG July 2023. Hope all of you would have answered it very well, and this can be a pattern of question that you can expect in upcoming December July FMG exams also. And hope you have done well. Please don't get tense, and definitely you will come out with some of the good scores. Okay, thank you. If you have any doubts, you can put it in the chat box or the comment box, and if there are any discrepancy in the questions or options, please do let me know, or if any other questions were asked in the exams, also you're free to comment it on the chat box. Thank you.